an original.
From Story Studio Network.
I'm Tom Hoppe, and I'm your host of the Most Painful Podcast. Due to public demand, we are recording 2 more encore episodes for Season 6. And I want to thank all our listeners for supporting this show. On the last episode, we had Dr. Andrea Ferlin on the show discussing how journaling can help a person with their chronic pain. There was lots of good information, so if you missed that episode, you can listen to it on our Spotify and Apple feed. And remember, subscribe, hit like to get the most up-to-date episodes. Today on the show, we have Dr. Brenda Lau, a well-renowned pain specialist from Vancouver, BC, who will discuss rewriting women's health and chronic pain, which is health for all, including males. Brenda, welcome back to the show.
Thanks for inviting me, Tom.
So this sounds like a big topic. So maybe you could just start us off and start peeling some of the layers of the onion and tell us what this is about.
Yeah, listen, Tom, this is a lived experience journey. I have a Dr. Brenda Lau hat, and I'm a patient Brenda Lau as well. So as I've entered into my own 50s, this perimenopausal journey really came upon me, and it is in both symptoms of the body and mind, but it really is about the opening the eyes, the lens of the health system that really only sees all of us as body parts. And when it comes to a number of these symptoms, when they're all connected, it doesn't work that way. So that's why it's really unfolded in a deeper way, both scientifically and also as a lived experience.
Yeah, so we're talking about, I know we talked a little bit offline about this, where women's health is very important because it's unique, and I'd like to get into that. But you also said that it would also help with males as well, too, because there's some crossover. I mean, we talked a little bit, I know we'll talk more about this, but muscle and fiber and creatine, and we're hearing more of those studies, Rhonda Patrick and Atia, those people are talking about as well. So maybe you can just start us from the beginning on let's talk about women's health, and then I guess we'll lead into how that's going to help with males as well.
I think what it is when we talk about women's health as a topic is it's not ever in separation from men's health. We are people, first off. Let's just make that as a basic foundational health principle here. But what we have found out in the last 20 years, evolving research, although there's been a big paucity of it in the 20 years since the World Health Initiative, but there's enough research out there to realize there is differences in the physiology, and that's the reason why this topic is becoming hot, not just because it's a menopause symptom or that 2 billion women currently in 2025 are in the age group between 40 and 60 years old. And so there's no doubt there's multiple factors coming on board as to why this topic is so important. I think the second thing of why people are talking more about this as well is because this age group of women are not only the moms, the caregivers, they are the support foundations for a lot of communities. They're also leaders. They are taking up 45% of the job, employment positions. And so it's a huge impact on them when they have symptoms that the healthcare system sometimes feel maybe just due to stress. And that's not acceptable anymore. So we are really needing to raise really practical suggestions, what you can do in your hands right now, not just waiting around for the system to right itself.
So when you talk about what people can do in their hands right now, what are some of those things?
So I'm going to take a lens of just as human beings, but there's always these nuances with women. And the reason why I'm giving this kind of two-direction discussion is because human is human. We all have problems with our bones and joints. We know muscle is medicine. We understand that we have to master our mind when it comes to sympathetic stress. So these things are all the general things we've got to do to master our health. But when it comes to women's physiology, there are particulars, because if we don't use those nuances applying to our bodies, we don't get the same progress. We get frustrated. I'm seeing complaints like I keep getting abdominal fat. I barely eat anything. And why am I getting weaker? So this is the reason why I want to have this other lens on it, even though all these principles apply. So I'm going to talk about 5 top principles because I have a lens of health, but I also have the lens of a pain specialist. Because when people come to see me, and that's all walks of life, when people come to see me, it's because they've tried the basic things. They tried the basic things of eating well. They tried the things of going to physiotherapy. They've, tried to keep up movement, but it's not working. And so that's where I'm going to take it to the next level. So when you've asked me about, let's say 5 top things, I'm going to list this in general. One is we've got to start understanding the neurobiology of the mind when we're under stress, injury, and or facing even change. The second is that muscle is medicine. And that's linked with movement is medicine, which is me talking about disrupting the sitting culture. A fourth one is always a topic of interest, is all about what do we eat? So that is on its own a big topic. But I'm going to hone in on a key supplement of creatine. And I'm also going to hone in on protein and how women need to eat it as compared to men. And then finally, it's really around all of this changing the picture of inflammation for us, because pain is really a big barrier when it's coming to trying to adhere to foundations of health.
Yeah, and I mean, as you're talking, I'm thinking about, many of the other podcasts, many, advice you get from GPs, and when you hear just talking to people in general, there's this talk about you got to exercise, you got to eat well, you got to take this. But what does that really mean? I mean, it almost seems like it's a blanket statement of, get out of my office, here's exercise, go do it. Okay, well, what do you do with that? And then, I guess I'd also like to touch on too is how do we make behavior change? Because yes, we know that we need to do this, but how do we do that change, ever long-lasting behavior change?
That's it. Tom, you've hit the nail on the head here, because we know those basic principles of health. Like, in fact, it's under one acronym, right? SHIELD, SHIELD. If you want to keep it super simple, you need good sleep. You have to handle your stress properly, have really positive interactions. E for exercise or movement. L is the words feeding your head, learning, right? L for learning. And D is dietary, food for the body. And people know those in general principles, but how? So here's an example. Okay, so of the top 5, I'm going to just talk through the first one. In the situations when we're facing stress, we've got deadlines, we've got new injury, we've got symptoms we don't understand, or even we're facing change. Our bodies are so perfectly built to deal with stressors, like as if it is a life-threatening situation. And there's 99.9% of our average day in our current culture is essentially not in a life-threatening situation, but our brains still think that way. And so I know that you've got podcasts before talking sympathetic systems and parasympathetic. So we understand that if we are able to control our response to stress, you're already winning in the game, because you're, first of all, controlling cortisol release, which is the stress hormone. We know that if that's released for too long, you start having all these body changes, you make decisions a certain way. So we know mastering the mind is important. And so with this lens of the woman's response, this is really important to capture when it comes to women's health. When we women are under duress, not only do all human beings secrete cortisol and your adrenaline to make decisions, do you fight or you flight, you have to deal with the situation, but women also secrete oxytocin. This is powerful, new, recent knowledge to know that when we secrete oxytocin, the fact that our desire, natural inclination, when we're the ones hurt, bodies injured, we're facing the pressures, we'll literally put everyone else in front of us. We'll literally put their priorities, their needs first before even ours. That's an important principle to understand, because a lot of women feel shame, guilt, embarrassment, selfishness, or they're even made to feel that way, or maybe they're picking it up from the environment because of the way their neurobiology is, so that they themselves become the first barrier. Oh, you know what? I'll finish all that first and then I'll do this. Oh, I heard the doctor tell me I should be exercising, blah, blah, blah. But they don't literally do it because they're putting all these other priorities and they don't realize that. So the power is understanding that that's what we naturally secrete already, which is not a bad or good thing. It's understanding its place. So now if we reframe it and realize, oh, I'm hurt, I need help, and I am going to put oxygen on my face first, like the airplane analogy, that's not taking away from anybody else. That's actually putting more into the system because I'm taking care of self first. So understanding that neurobiology is super key for women's health and action. That's the first point.
Yeah, and I think just to kind of help the audience, I mean, because that was a lot of information, but to say when you're putting the oxygen mask on yourself first,
Mm,
that then what you're saying is you start looking after yourself, you're lowering that stress, you're lowering inflammation, then you may move more. And so this is what that's about, is about looking after yourself so you can then help others. Is that correct?
that's it. That's it. And it seems obvious, but it's not because I see thousands of patients. And again, it's always people tell you, you do this, you should do this. And people feel it's like a checklist, but then it becomes this piece of work. And we don't address the words in our head, our feelings, our response to this. If we don't do that, you don't realize why you are procrastinating or why you're not able to do what you want to do. So that's why I say we must address that first in terms of the health from a women's and a men's lens, but especially a woman who's under duress, under stress, under injury. That's what's happening in her head. So as both a provider and you as the patient, and that's me as well as I spoke to myself, is that until I understood that, then that was my first barrier, was my own emotions, my own lens on who I should help first. I had to help me first if I was going to help other people.
Yeah, because I think sometimes, people feel that everything's fine, but really it isn't. Like they may know there's something in their gut saying everything, but I'm just going to push through life and do that. But that awareness, and maybe it becomes normal after a while, right? It's normalized.
That's right.
You go down this path of not getting better, I guess, in a sense.
Well, closing the loop on that, because what happens in our culture right now is that we are not taking a preventative lens. So often I will have, if someone showing up, asking for help for back pain, headache, whatever the pain symptoms are, or whatever symptoms, is that if we're not looking at not only dealing with the situation at hand, but also looking, what are we preventing? So for example, if a woman walks in my office, I'm not only looking at her headache or back pain or her complaint, I'm looking at what age are you at right now? Oh, you're 30, you're 40, you're 50, you're 60. In whatever age you are, we have to always put it in the context of perimenopausal journey. It's super important. Just like if I see a man at 40 versus 60, very different set of circumstances because literally the hormone levels have fluctuated. It's just that the male journey is a lot longer, whereas most average women, it is already stopping, reducing in that time frame of 40 years old and up. And that's why there's an urgency to speak to this topic first at the mind. Now, what do we do at the body? Because you were asking me about other tips on what do we do now with women's health. So I'm taking this as a lens of don't just look at the pain. We've got to think of the prevention piece long term in the journey ahead.
And when you talk about prevention, I've heard that on other podcasts, and people say about putting money in the bank. That analogy. If we're talking
Yeah.
about muscle health and that, but even if we look at our medical system now too, it's probably good to be healthy and be preventive because it's better for you as a person, and you're not trying to trying to get into a system where you need help that maybe the system's overwhelmed, right? So look after yourself first. Maybe I'm stretching that a bit, but.
Not at all, actually. We always want that. The system never is the solution. Every doctor, every health provider is meant to walk with you, but no one can substitute the work you have to do. And that's actually my second point of a big tip of what we can do now. Muscle is medicine. I always say to my patients, look, I can have options giving you needling procedures to relieve pain. I can do fancy things, infusion therapy, give you medications, even support you in a nutritional kind of directions, like I'll say today. But I can't do the work. So despite the pain, I can't do the work only you can do to make muscle and bone. I could guide you. I could walk with you. I say, I see you and I see the struggle. And that's why we're going to find a path together. But I say, there is no choice. We have no choice. And it's not about what state of the medical system we're in. You literally have no choice as we age through our life journey.
Yeah, so we talk about let's talk about muscle for a bit because you said muscle is medicine, and I mean it's a sink for glucose, it's for movement, keeping us stable, all those things. So it goes back to what we always hear: go exercise, go build muscle. But what are we really talking about? Because there's also a nutritional fact tied into muscle building. So maybe you can talk about both those things: is what do we do, and how do we strengthen ourselves, not with just resistance, but also with nutrition?
I actually want to take it one step back first. What is muscle is medicine? Because if you put that mantra in your head, all of a sudden that's also a way to remove the barriers that this is too hard for me. So let's think of muscle not only as we're moving the skeleton, but as we age, there's no doubt muscle itself is the only way we're going to strengthen bones, strengthen the tendons, all the things that causes pain in the joints and the stiffness and this immobility and balance problems. Okay, so we already know that one. The second, most people should know, it is a big storage for glucose, and it's huge because we know it's an energy store. And let's put that one away. But a lot of people don't realize how much it has an impact on mental health. In the recent years, especially last 5 years, the myokines that are secreted literally are antidepressant molecules. They cross over to the blood-brain barrier. They have a direct impact on the brain. The muscle also creates numerous of neurotransmitters and chemicals that literally will be directed at the heart, your microbiome, and your liver. So we now realize muscle as medicine is not just because muscle is for movement and strength. It is just like every other organ system that we're starting to find out. They have their own intrinsic capability to reduce inflammation in the body. Okay, so those are some big key principles. Now, having said that, let's go back to its primary function that we are all aware of, which is keeping you strong. And there's no doubt making muscle is always linked to movement because especially when we're greater than 30 years old and we don't have those levels of growth hormone anymore that we used to in puberty and in the 20s, we now make muscle only through a couple of ways. It is through strong movement, meaning movement against resistance. The stimulus the body needs to make muscle needs to be louder. And what I mean by that is before 30 years old, even if you were just moving, going gardening, just small movements, your growth hormone helps you build the muscle because you are primed to do that. Without that, you need a lot more nerve system, brain system stimulus that, oh, the body needs to make muscle. It knows that when you are trying to, let's say, lift heavy against resistance, moving faster. Why is that important? Because it is saying to the body, oh, I need to rebalance the making and the breaking because bones, muscles, all types of our system tissues are making and breaking all the time. But there's a balance that gets shifted when our hormones are starting to fluctuate. For women, it starts as early as 30. The average of the male shift is much later, 40s and then into the 60s. And so you don't see them having those big symptom shifts right away. But women see it very quickly in a short period of time. And that's why it feels a lot more dramatic. So before getting there at 40, 50 years old, we can start early on by building muscle, meaning let us move with resistance. Let's do it on a regular basis. A lot of people tell me, I have pain. I can't lift weights. Don't worry about going to the gym. Let's just get started that you are intentional. Intentional, let's say twice a week, even once a week. But it's about regularity. So if we start training our bodies being regular, intentional, dedicated work, not just you're doing housework, not just you're doing your work at your work, but you're training the body. Second, sometimes because we're not used to doing all this, it might be better and safer to get what is called a functional baseline assessment. So a well-trained kinesiologist, physiotherapist from head to toe can evaluate where are your gaps, strength, mobility, range of motion, your stamina. All of those things gives insight into where we need to start first. I'll give you an example. So I had very bad knee arthritis, and this is because I ran a lot of marathons, but I wasn't taught to strength train. Because of all that, this knee was really weakened and to the point where really I should have surgery. But this pain doesn't need to stop me if I built muscle. So when I started doing that, which was really painful at first, I didn't think there was any progress. But when I built enough muscle, now the joint pain's gone. Okay. And now it can move. And so this is a good example where we now, if you put into regularity, if you now progressively load, so you get your functional baseline, you now understand your data, where you're at. Then you shift this program every 4 to 8 weeks, because that's another problem. People tell me I'm doing exercises, but they don't change it. You don't change that load. You don't change the stressor on the body. The body just stays status quo. So that's a third key piece on the exercise and strength. And then the fourth one is, how do you build muscle with your food? Because if you don't eat enough to build, you won't build. And I know that. My personal experience, when I found out about osteoporosis when I was in my 40s, surprised, shocked me. The first thing I did was, I need to build muscle to build the bone. But when I was just doing exercises without eating for it, I actually lost more muscle and lost more bone. And that's what really shocked me into this direction. I said, what I used to do is not working now. And that made me realize we must have this advice in the context of our age, in the context of our current capability, and you must be very conscious of what you take in. So if you don't know how much protein you're taking in, and you need at least a gram per pound per day, and you don't know how much you're taking, you for sure are not taking enough.
Yeah, and that's a gram per 1 pound of body weight,
Ideal body weight.
which is a lot.
It is. So that's why you have to be intentional, just like the movement now. And that's why the movement has to be intentional. And that's why the food needs to be intentional as well.
Yeah, and I think that is important. And then there's the big talk right now you hear out in a lot of places, of course, is creatine, right? And I mean, I've had my doctor say, don't take too much of that. It's hard on your kidneys. And then there's people who say, no, it's fine, and then, well, now you should have it. And so, I mean, as with any research, it's always changing. But maybe you can just, with a few minutes we have left, maybe you can just touch on the importance of that as a supplement to help with muscle building.
Creatine is the most studied supplement, thousands of studies, especially in high performance. And now it's trickling down to the everyday person's hands. And the studies initially with the loading is the 5 grams, 4 times a day, 5 days in the first 5 days, and then it's 5 grams per day. But really, they're looking at not only creatine for muscle building, but it's actually for brain health and heart health, because creatine is the base molecule for our energy molecule, adenosine triphosphate, ATP. Of all our functions, we need this molecule. We make creatine, we store creatine, but this supplement adds further. So for example, in muscle building, that 5 grams a day will give you about a 10 to 15% extra oomph and capability. And that doesn't sound like much, but when you build that over time, it's a lot. The second is that the studies now, from a combination of brain health and muscle health, between 10 to 20, the studies have even gone to 20. I right now am asking people, if you're going to go higher, look at 10 grams. It's a pretty moderate dose. That only few people cannot take this. Those with no kidney function or very little kidney function, because you can't clear it. And the second is pregnant women, because the studies haven't been done. So really, outside of that, know that when you take creatine, many people will get swelling. So those who already have a lot of swelling, you have to be quite aware of that. And so focus on the muscle building, all those patterns to help move the lymph and help move that fluid, and eat for your muscle building. And then when you layer the creatine on, you can deal with the swelling, because over time it will go.
And I think that's the important thing with creatine. It's you got to do the work if you're taking it to see the outcome. Right. You can't just take it and watch soaps on the couch and expect to gain muscle. You got to do the work.
100%. And in fact, I want to build on that last piece. Not only you have to actually stress the muscle, because if you don't stress the muscle enough, when we're older, the muscle doesn't have the right signal to grow. To grow muscle, you actually have to break some of the fibers. And then the body is signaled, oh, I've got to go back and repair, and I'm going to repair it stronger. The second point I want to build on that is, you're right, we don't want to sit around. We already know there are studies showing that when even you do that average of the recommended 150 minutes per week exercise and you're doing it well, but if you sit more than 4 hours a day, you have just negated all of the benefits of your exercise. What I mean by that is that It weakens a very core muscle in your abdomen area called transverse abdominis, in addition to the fact that it makes all these other small muscles tighter, like the ones that flex your hip when you're walking upstairs. So you can imagine when you're sitting too much, this position now becomes your main baseline position. And then the back pain, the stiffness, all these derangements happen because the muscles themselves have been trained this way. That's why we cannot sit more than 4 hours straight. We cannot keep on even in the 4 hours totality in a day. If you can break that pattern, is the best. If you are breaking the pattern, even fixed standing is not a good thing either. You don't want fixed sitting. You don't want fixed standing. You want 3D movement. It really is about moving the spine, moving the muscles. It is keeping the feet strong. And so positions like squatting, etc., we have to find a way in our homes, in our works. So we have to find a way.
Yeah, and then that gets into behavior change too, because when we talk about muscles, it's also the heart's a muscle as well. And it
Correct.
needs to be worked, right? So everything needs to be worked. And so there's work that people have to do in order to get that health. And I would suggest from my experience and speaking with many people who listen to this show, is that they know they have to do something, but it's doing it is the challenge. Changing that behavior. And we got a few minutes left, so maybe we can just touch on that quickly.
The rewards when your body responds is itself the motivator. But to get there is where what we have to overcome. And that's why I spoke first the words in our mind. It's very important because there's many reasons why. I'm too busy, I'm too short, I'm too old, I'm too young, I'm too Chinese, I'm too not Chinese. I mean, there's so many different reasons. And every single time I hear a reason, I say the following: put the new words, the mantra, build muscle. Change up the words in there. As soon as you hear any of those other words, just put the mantra: build muscle, build bone, or find a way. As soon as you start new words, you'll need action, because if we don't pair an action, when I hear words try, believe, and hope, they're not helpful, because if you don't pair them with action, we never move forward. So the second thing is just set a fixed schedule. Make it Monday every 5 p.m. It doesn't matter how you feel, you're dedicated to this. And as soon as you start training a rhythm, it begins. Third, you start to see the accumulation of the effects, and it itself becomes the dopamine reward center, because you see how balanced you are, how strong you can feel, how capable and independent you become. These are so amazing rewards. But this, no doubt, you need a good provider group, because when the pain hits, or when, let's say, you feel not so motivated, you need to be paired up with someone who says, you know what? I see you. I believe you. I'm a patient too. We're going to do this, and we're going to do it together. But you have no excuse, and we will not let you go. And there is no excuse now anymore. Pain or no pain, we must find a way. And those are the words we must start to replace with. And everyone can. I know this doctor spoke to this patient in the same way.
And that's how we're going to end it, because I think that's it. The words are important to provide change. Brenda, thank you so much for being on the show. I know we could talk a lot more. I mean, all these episodes, I could just talk so much more. So maybe we'll have to have you back. I have to have you back.
Thank you, Tom.
To our audience, I mean, this ends our encore special for the Most Painful Podcast. So stay tuned for season 7, where we'll have many more health topics that'll help you stay healthy. For feedback about the show, or for more information on chronic pain, you can visit our website, veteranschronicpain.ca, or follow us on Facebook and X at Chronic Pain COE, and on Instagram at chronicpain_COE. Brenda, thanks again. To the audience, stay safe, keep the hope alive. And I'm going to add something. Put the words in your mind and change your life for the better. Thank you.
The Most Painful Podcast is produced for the Chronic Pain Center of Excellence by Story Studio Network.